is twofold, I'd say. So to bring together stakeholders who are working on improving coordinated systems for early identification, developmental assessment, services and supports, and family engagement related to children with or at risk for autism spectrum disorder and other developmental disabilities. And then to offer meetings and other activities. It's not just these 3 meetings a year, but to support ways to come together, some of which you'll hear about today, that create an opportunity for the team members to share and align their work in this area. So we've structured our meeting to be able to share a good deal of what's going on and to open possibilities for more. So next slide. This is just a placeholder. You would have seen this if you were in the history presentation part. I'm not going to go over everything that's on this slide, but this is just to point out that the ACT Early State team has been around for a while, and our focus has shifted over time in terms of what we're putting a spotlight on. So most recently, you'll see in 2016 to 2023, there's been a strong focus on disparities. Those of you who have been part of the ACT Early State team for the past few years will remember that we had approximately an 18-month period of time in which we were really focusing on disparities and evidence-based practices, and we had a quality improvement cycle across the meetings during that year and a half. We've had a break in meetings, and now we have a fresh start. And today is going to be really an opportunity to catch up on what's happened, some spotlights of what's gone well, but then to get a sense of where are we right now and where do we want to be going. So this is a reset. Still the same ACT Early State plan, but a reset. So that's good for you to know if you've been part of the state team. And for those who are just joining now as replacement representatives or a new agency organization, nothing lost, we're starting here. So I think we can move forward. I am going to introduce our ACT Early ambassadors. So I mentioned previously that this was one of the efforts, and I want to turn the stage or the mic over to Chris Barnico to introduce herself more and just give you a few words about the ACT Early ambassador effort.
Hi, everyone. I'm excited to be here to talk about the ACT Early ambassador role and a little bit about how I came into the role. I was serving as an occupational therapist in birth to 3, as I had mentioned, and really saw children slipping through the cracks and saw children close to their 3rd birthday and was wondering why they weren't identified before that. And so I began a journey really exploring what barriers there were and existed around early identification. And from a professional perspective, really learned that occupational therapists weren't being trained in early identification. And so I'm very excited to be in this role because not only can I reach out to my fellow occupational therapists, but also at a larger scale and work throughout the state, helping to improve early identification and referral services. So I'm here to give a little update. I became the ambassador in 2019. It's a 2-year role. So my appointment ends in 2021. And at that time, as Gail had mentioned, this is a competitive role. So I'll need to reapply for the ACT Early ambassador for Wisconsin. Next slide, please. So as ACT Early ambassador, our responsibility is to develop partnerships, and we have goals that we are to work on throughout the year. And most of my goals have really been to do education and outreach And so the one picture, I have a student at the University of Wisconsin-Milwaukee who is helping me present at conferences. And because of the work in early care and learning centers, I reached out to the UW-Milwaukee School of Continuing Education because they provide a lot of support for early care and learning professionals. And so we were invited to have a booth or exhibit at the Pathways Conference in Milwaukee. And so that's Haley on the right there. And we did some outreach just introducing the materials to the participants at the meeting. Of course, we were to be presenting at a variety of different meetings. I had the opportunity to present at the Head Start Association conference in February, and then unfortunately COVID happened, and there were presentations and conferences that have been shuffled around. So I will be doing a webinar with the Wisconsin Association of Perinatal Care in September. And again, just really going through and talking about developmental monitoring and the role that developmental monitoring and the Learn the Signs Act early materials have in early identification and referral. I worked a little bit with the Well Badger Resource Center on, they were developing this screen and for their webpage around early identification. So we did a little bit communication around delineating the difference between developmental monitoring and developmental screening. So those were my two goals. However, the CDC is asking us to engage in additional processes to identify how the Learn the Signs Act early materials are being implemented in statewide systems. Next slide, please. So the CDC is now requesting ambassadors to really explore and better understand levels of integration of the Learn the Signs Act early materials and program within statewide programs and systems of care. And specifically, they're looking at how are the materials being integrated in primary care, early Head Start and Head Start programs, Child Find systems, and WIC programs, home visiting, and also early care and learning programs. So we are now being asked to survey these programs and collect data to see how the materials are being integrated into programs. So it's possible in the near future that you'll be hearing from me and I'll be asking you to answer some questions so that I can give feedback to the CDC on how the Learn the Signs Act early materials are being integrated. And these are just some examples. So the examples on the previous slide were really passive promotion of the materials, attending a conference, having materials displayed. That's an example of passive promotion. So they want to know how our programs, statewide programs, displaying the materials or do they have, for example, a digital Learn the Signs Act early web button on their web page? Does the system of care actively distribute the materials? So again, are they actively distributing the booklets or a brochure or the checklists? Another level of integration is providing the Watch Me training. The CDC has a wonderful Watch Me training that is really designed to support professionals' understanding about Learn the Signs Act early. And it's really a nice support for early care and early learning professionals. Next slide, please. Wonderful. I wasn't sure if this slide was in there as well. So there are 5 levels of integration. So the next level of integration is actively distributes the checklists. So for example, our WIC programs helping families by actively distributing the checklists, or helping families by using the CDC has a new app that parents can download, and it's really a nice way to go through and engage in developmental monitoring. And finally, the 5th level of integration is actively completing the checklists or working through the app with families, and then helping families get to next steps. So if the family does identify a concern, then helping the family go and have a screening either completed or an electronic screening. So really helping families get to the next step. And then if there are red flags on the screening, helping the family then move into early intervention or early childhood services. So again, what's new is that there's a level of data collection that the CDC is requiring ACT Early ambassadors to do to get a better understanding of how these materials are really working throughout the state. Next slide, please. Okay, so what I'd like to do, I am geographically bilocated in the state. I am in Milwaukee. I work at the University of Wisconsin-Milwaukee, but we have a home in Eagle River, and having a home in the Northwoods has allowed me, and I've been fortunate to collaborate with partners up in the northern part of the state. And so I'd like to introduce Corey Dart, and I've been really fortunate to be able to work with Corey over the last couple of years around some of the early identification activities. And so Corey, take her away.
Well, thanks to being part of Wiki, we were able to connect with Ascension, and some of the medical staff there became very interested in providing more diagnostic services closer for families. Families were having to travel, anywhere from 2 to 5 hours away for diagnostics, and then, go back to do their plan. And it was just really complicated, especially for families that didn't have good transportation. So thanks to Wiki, like I said, we were able to collaborate, and Chris coordinated a training for the Ascension staff to develop a diagnostic clinic, which was supposed to open March 1st. So guess what? So right now they currently do not have anybody scheduled. The families that they were looking at, there were a few scheduled to start the 1st, but they're all on hold right now. And when I talked to the OT, she said they just don't know when they're going to start. So they're ready to go, which is positive. I also sit on the advisory council for the Nicolet Technical College Early Childhood Program. And through, a couple years of talking with them and child care providers talking with them, they will be offering a 3-course certificate for families and professionals, working with, people with autism. And they're going to, like I said, work across the lifespan. So that was pretty exciting for especially the child cares. We do have a treatment facility in Rhinelander, and they have provided some limited in-person services and some via technology. So families are, feeling kind of hung out to dry right now, but we're moving forward. So hopefully life goes back to normal soon.
Thank you, Corey.
Thanks.
So this is one example of what I mentioned is a bright spot. That's language that we are taking from an effort we were engaged in with Robert Wood Johnson Foundation and the Institutes for Healthcare Improvement. So it's just a spotlight on something that's gone well. Obviously, as Corey's pointing out, there's some ways in which this is on hold at the moment because of COVID-19, as much of life is. But in any case, bright spots are something we want to keep coming back to and looking at together. And it's not completely obvious from what we've been able to summarize here, but there are ways in which this broad Act Early Estate team created opportunities for people to come together and partner to help make this happen, to help support the ADOS training, just bring info to people as they needed it. And it's an instance of identifying a local need and working together to see how collective resources might be able to be mobilized to address that. So when we do bright spots, we want the folks who have been engaged in that work, who are here, to be able to share that out, and then take a moment to be able to field questions. So if there are things you'd like to know about what was pursued and how this is an opportunity, or about who else was involved in it, this is an opportunity to do that. So I just want to take a few minutes where we'll leave space here for questions, and you can just unmute yourself if you have a question.
I'll start. Corey, your 3-course certificate for families with Nicolette. How long did that take? Is that offered on their website? One can look it up and everything. Otherwise, you know me, I'm gonna call you and see what that looks like, because I've been trying to network with Southwest Tech down here, kind of along the same lines.
I don't think they have it on the website yet. They're waiting on the final approval from their board or whatever, I don't know, collegey thing you have to do to have courses approved. But yeah, it's going to be, there's going to be an autism spectrum disorder overview, autism strategies, techniques, and tools, and then autism navigating life's transitions. So I do know they plan to bring in experts. They've been talking about it probably seriously for a couple of years, but I think, being part of the Wiki grant, I was able to bring some of the information, some of the different Learn the Signs Act Early things, and say, we really need to be focused on this. Robin from our child care and resource up here was also integral in helping to move this forward. So I'll let you know, Rose, as soon as they send me final approval on it.
Thanks, Corey. And those who don't know, Wiki, I think someone mentioned, but it's the Wisconsin Care Integration Initiative, which is the name of one of the state autism grants that we had. I'm also interested, Lindsay, if you're on the line at the moment, that I don't know if you have any comments that you can contribute just related to what's happening with telehealth and the types of tools people can use to bring diagnostic capacity to the community, and what kind of opportunities might there be in local communities to further develop their diagnostic capacity near home?
Sure. So as many people have, we adapted pretty quickly to doing telehealth visits for diagnostic evaluations. And there's been a lot of information from national and international partners about the use of the ADOS when you have to use PPE or when doing that via telehealth, and how it's not really an acceptable tool in the current situation. So we have to think about what other tools are available to us. And when it comes down to it, best practice is really a structured observation. And so we've kind of modified different activities from the ADOS to come up with some structured observations that we can conduct via telehealth, and then using alternative tools like the Childhood Autism Rating Scale or other tools to help make and inform our diagnostic decisions. And so I think this is a really nice opportunity when we think about access and access to ADOS trained diagnosticians, that maybe we can expand how we think about autism diagnoses to increase the access and availability.
And Lindsay, do you see the chat there from Joe?
Yeah. So I am familiar with the BOSA. That is one of the tools that has been developed. I think several different agencies, including Vanderbilt, have come up with different observational measures. Many of them are effective for really young children. The BOSA has an expanded age range. We have chosen not to use that because it involves mailing materials home to families, and we don't have the capacity to do that. But we've kind of taken information from all of the different tools that have been developed to develop our protocol.
And Lindsay, if folks are, folks who are on the call, because I know we have some physicians and Joe, and if they're interested in learning more about where the field, the diagnostic process is now, like what the cutting edge is or what the recommendations are. I know there's been a number of webinars and resources. Can you describe what they might turn to first, and we can share those resources after the call by email?
Sure. So there's been a lot of information from other university organizations, so Kathy Lord's group and Vanderbilt, but where we've gotten most of our information is from a collaborative phone call that happens twice a month with ADOS trainers and other diagnosticians throughout the world. And that is an open call. So if anybody is ever interested in joining that or participating in that, I'm happy to share that information as well. So you can contact me. If you don't want to join the call, I can also share materials that come from that group.
Great. Lindsay is one of the staff who's the clinical trainers who's been involved in Echo Autism, which is, I don't know how widely that's open or recruited for. Lindsay, I don't know if it's just within UW or are you open beyond that?
So, and Danielle's involved in this as well. So we are open to any physicians throughout the state, not just UW Health. We do start next Thursday. And so if anybody's interested in signing up or learning more about Echo Autism, please also contact me before Thursday and we can get you registered.
So if you're a physician and you're on this call and that's of interest to you and you have not heard before, this is your opportunity to get on the boat late before it sails. Any other questions related to the Northwoods work? Oh, can you tell more about what Echo Autism is?
Sure. So Echo Autism is based on the ECHO model, which is the extension for community healthcare option or outreach, something I always forget. So we are using a cohort model to help teach physicians how to better care for individuals with autism within primary care. So thinking about early identification, appropriate referrals, community resources, as well as medical management of common co-occurring conditions like sleep and ADHD, anxiety. And so there's 11 sessions from July until December. We meet twice a week. Danielle is the lead for that group in terms of sharing some didactics and going through case studies to help improve self-efficacy and knowledge of autism spectrum disorder. And it's based on a model that was developed in Missouri.
And if all goes well, it'll be offered again.
Yes.
After that, so.
And I just want to, I think you misspoke, Lindsay. It's every other week, not twice a week that we're meeting.
Oh, yes, thank you. And we do plan to expand to include training for psychologists and other behavioral health providers in the future.
Great, thank you. Any final comments or questions before we go to the next bright spot? Okay, so we can advance the slides and I'm going to introduce Rose Cutting's effort. So we are just, I am very excited about what Rose has been able to do. So Rose, why don't you fill us in?
Oh, well, there's no pressure there. Good afternoon, everybody. Nice to quote unquote see y'all. So I'm just kind of going to go ahead and both say what happened for our Southwest Region Equity Action Lab, but also try to make it more user-friendly so you can at some point see yourselves doing this model and or work. So go ahead, we go to the next slide. So I wanted to start here because just going with the whole visual aspect of it, because this kind of can show you about how much time commitment and so forth it took for having this Equity Action Lab. And I'm just going to go ahead and do a disclaimer here. I'm going to use Rose terms and so forth. Gail, Lynn, Meredith, Nicole, y'all need to fill in the more technical stuff. Y'all just go ahead and do that. So this, the prep work would be the identifying of those who are already engaged in the action or who might benefit from getting engaged in the action. Prep work collects the data, and we go from, you know, who's already talking, who's already networking. The part about the prep work that I really liked and I saw as valid for this model is you get in and you get to rank those that are engaged kind of on a scale of how much they're engaged, because there is a difference between being engaged and being totally engaged. And I think that allows you to make sure the right people are getting the right information and you're asking the right asks of them, the work, as it were. So that develops your, I'm gonna screw this up. That develops your leadership team that can be of a smaller team. Then you gather people for doing the design team that continue forward with your aim statement. Your leadership team kind of takes on what the overall action should be and starts to begin to formulate that aim statement. And then the work, most of that work is a day, 2 days. The awesome part about this is you can make it what it is. If everybody's schedule allows to get together, meet everybody, figure out what this action lab model is in the morning, and everybody still has the afternoon, you can make it one long day and keep everybody together and keep going. Develop solutions, set ambitious goals, develop those action plans. Those are all those 1-2 day models. When your design team comes together, be ready for a day worth of work. However, the way that ours ran and the way it was laid out, it actually was really nice because we came in, we got introduced to it, we figured out what to do, and by the end of the day, everybody left with a next step. So it wasn't one of those meetings where you come into and when you leave, you're like, now why did I just go there for a whole day? That sprint cycle is about 100 days, where that is where you utilize your quality assurance cycles and decide as a team how often and how you want to reconnect. Is it through Zoom? Is it through email, phone calls, actually in person? There's flexibility there about how to get together. And then hopefully at the end of that sprint cycle, you have a momentum lab. How'd it go? Everybody gets together, you network again, you actually go over what might have been produced from the sprint cycle, and then figure out next steps to sustain the movement. Sometimes with those successes, you also have to figure out what didn't work. And in my book, that's okay too, because you're still learning. The last thing I want to say about this slide is a couple of the personal feedbacks that came from the participants. And I'm going to just read them here so I get them right. One gentleman came up to me and said, this is the first time in a long time I've left a meeting knowing why I was there and what I'm expected to do next. He was really excited about that. And another participant got a hold of me and said, whatever documentation I have on this model, they would like me to pass it along to them because they were going to highly suggest and highly use it in their teamwork because they felt a lot really got done in a small amount of time. So I thought that was pretty cool. Go ahead, we'll go to the next slide.
And Rose, I'll just pipe in and say, I should have said this as I introduced you, but for this bright spot, you know, we're talking about an Equity Action Lab, which is a model that we were drawing from Robert Wood Johnson Foundation and Institutes for Healthcare Improvement. And it can be utilized, it's sort of a community development model, a community-based effort model. And it was used in Rose's case to address early identification concerns in the community. But yeah, so I should have said that as I teed off for you, but adding it late, but continue on.
That's all right, that's all right. Okay, so why did this model work so well? So the first thing is having those most impacted by the action need to be in the driver's seat. Who are your stakeholder? Like I said, who was engaged, who needs to be engaged, partner with resources who can act as an incubator. So this was essential, I think, for us. Right now, if you're looking at my video in the background, I'm at the Learning Center that I think a lot of you guys that have been involved with this for a while have heard me talk about. That is the tree that I referenced. All those people on there supported this effort. And so I felt like I was able to bring to the table some partners that were engaged, but being able to have Gail and Lynn and the Wiseman Center and Wiki Project, all of you folks, whoever was engaged with it, on more of a outside of Southwest Wisconsin, you brought the ability for us to tap into resources we weren't going to be able to tap into on our own at a quicker rate. I'd like to think that at some point I would be able to, but y'all brought that in quicker for us. And yet we're able to say, you know, we're going to be here, we're going to help you get started and so forth, but this needs to be yours, what you need to make it, which was very appreciative, because then it didn't feel like somebody was coming in and telling us something and then walking out and we're left what to do next. So that was really good. Go ahead. So what are the resources to help move the action? Who makes up the leadership team decides on what the action needs attention. That leadership team was really cool. We all gathered here at the center, and it was, in my opinion, it was a lot of high engaged stakeholders that came from places like CEOs of our hospitals around here, some physicians and so forth. It was just, to me, it felt like the right people at the right time. Some of them were very open and honest and said, you know, we can be part of this, but we can't allow time for all of it. But by the end of the day, they themselves couldn't come back for the next few meetings, but they did see the prevalence and the need for this action and sent representatives from their places and their steadfast. And it wasn't even the low guys on the totem pole, it was the second in charges and so forth. So that was nice. That kind of validated what we were trying to get done then. Then your design team, they take that beginning of that foundation, that aim statement, and they really take and make it into a workable statement. And that design team for us was a bunch of individuals that were ready to get the work done. I think the next slide, I kind of go into a little bit more about that. But I just want to stress the need to have that quality improvement cycle be part of this, because it kind of keeps you on track and keeps you going there. How will the community continue the work? That's kind of always, okay, now we've started, how does this keep going? One of the key factors for ourselves and for any work that's going to be done for a community is to keep that community's voice heard. Ours was more family input, because in the end, we saw the families as the drivers for trying to get the physicians and people to start turning their minds around to, yes, it's okay to keep diagnosing and so forth, even though you don't think we have the resources here. I'm not gonna lie, it takes a lot of vigilance to keep the work going. You really, really need to make sure you're not, that action, that aim isn't up here, that you're you're here where it's workable and you're workable and so forth. Because, you know, poor Gail and Lynn, you know, every time I had a question, which was probably about 5 times a day, I'd be emailing them or texting them or something, be like, yeah, so idiot here again, can you fill me in? Because if you're gonna have that local person and they're gonna be starting from their comfort level might not be the same language and resources that the people that they're trying to impact the work is. So you really need to make sure that you're able to assist that community and keep it within a workable framework. The last thing about that I will say, sorry, I just had a handwritten note here, is again, just to reiterate, make sure it's not your agenda you're trying to get across. I think right now there's a real easy way for society in general to try and get one's personal agenda across. Just make sure it's the communities. I would say our Action Lab really, really kept the focus on what the community could and would do. So make sure that's up on your top foremost. Okay, so let's get more into, go ahead. What was the aim? What did we see? So the standard of practice for screening and referring kids, that was what we saw as really needed some aim, some action towards it. But by who or whom, as it were? We were able to split into 2 groups, an education group and a healthcare group. That kept 2 sets of eyes on the same end goal, but was 2 first point of contacts. We did start off with thinking, okay, we can make this a 5-county area, and then quickly discovered that's a big area. And so it seemed like we had more engaged people in the Grant and Crawford County areas, so that's why we honed in on those 2 counties. Now, but by when, right? We did end up setting a date at the end of the first sprint cycle to give us that time factor that, okay, here's the end goal, let's see where we can get by then. And then how much do we increase this sites, these entities that can help with the screening and referring of kids? There was a lot of numbers and a lot of discussion on this, and I think by the time all the data was collected and everything, we all kind of agreed that 5 would be a good manageable number. So at the end, this is the final full statement that was made from the group. So by July 31st of 2019, we will assist 5 healthcare and or early childhood sites in moving closer to the standard of practice for screening and referring children 0 to 5 years in Grant and Crawford counties. So that is what we ended up with at the end of a day, which I thought was pretty cool. I don't know, for some of you that might sound like we got a lot of work done, some not so much, but if you were in the room, you knew that was a lot of work. So what is my next one? Okay, what were the actions taken? So both, funny enough, we all kind of split into our own little work sites within the building there, and both the education and medical tract decided to conduct a survey. The questions centered around policy and comfort level in doing developmental screenings or monitoring. One of the main reasons we did that, go ahead, is to make sure there was quite a discussion on all of this, but then it kind of started dawning on everybody, we don't really have a basis to go on. Where's our ground level here? So that's kind of why we all want to do the surveys, is see where are people for sure. Not just in our minds from conversations we've had, but where are the actual medical fields? Where are the actual daycare providers on doing all the screening and or monitoring? So the information we learned from these surveys were screenings were not being done from either medical or educational And the reason that some of them weren't doing them, now there were a few bright spots, as it were, that, oh yeah, they're doing it, and they checked on the survey that they were rock stars. And basically once Jamie Cruel is the Grant County one of the Grant County health nurses, and she was a champion on this for the medical side. She took it and ran with it, and she apologizes for not being here today. However, as you can guess, with her being a county nurse, and if any of you have noticed, Grant County, our numbers go up now finally by single digits a day. So she is very busy right now. But once somebody said that they identified as being a champion, they pretty much will stop talking to her, and she just kind of put it on her watch that she would just check in with them once in a while and see if there was anything else she could help with. So if they said they weren't a champion of these screenings, what's your reasons? For the most part, both medical and education came back the same reasons. A lack of training. Some had been trained, but it had been so long they didn't feel appropriate to go ahead and continue the work. Some, it was time. They didn't have time to do the training. For the most part, lack of education on how to best support the family on next steps. And basically, there were entities, both education and medical, that flat out told us, look, there's no place I can, oh, so a bird just hit my window, that's fun. Squirrel, actually bird though. They actually would not screen kids even if they had a suspect, because they knew there was nowhere to send the family. And for years, I've kind of secretly known that was kind of the motivation for building the center and the work we do for aiming for acceptance. But to actually hear it and read it on paper, in a weird way, was inspiring. It's like, okay, let's go. You know, the worst thing you can do for an Iowa German farm girl is tell her no. So they just inspired me, is all I got to say. So what actually happened? Okay. What actually happened from the medical standpoint? Go ahead, you can flip all three on. So 8 practices accepted professional outreach offering from Children's Health Alliance, which was really cool. 3 sites actually held, oops, go back one. 3 sites actually held the 60-minute lunch and learn, where 29 staff members were trained, 10 of whom were clinicians, and 19 evaluations were completed. Okay, so I'm reading the screen that's before this, but that's okay, I'll get to this one next. Jamie wanted to make sure and do a special shout out to Children's Health Alliance and Naomi, and also Tim, for attending and doing those. She thought the actual, so Naomi, your trainings were awesome, and Tim, you're being there in person to talk about how it was for you as a parent, just really for that group hit home. So, so what happened for the educational, we'll go on, there you go. So the ASQ3 training for daycare providers in Grant and Crawford County. This was, I did have 8 daycare providers, so I kind of took the lead for this. The 8 daycare providers registered for a total of 29 participants. And when you know it, the date for that was supposed to be March 21st. Yeah, nope, thank you, COVID, right? Are you sensing a COVID theme with this whole meeting? I did try to reach out to the facility from Madison that I've been working with, 4Cs, and they are not doing any type of virtual training. So if any of you have access that I can tap into, I have daycare providers more than willing to sit through a virtual and go from there. So that is what we would really like to tap into to keep going and not have to wait for face-to-face. We did develop a list survey for key partners to keep updated on what each other is doing. One of the things that we found out for both teams is that things are kind of still done in silos out here, and we're literally and figuratively, because it's a rural equity lab, right? We aren't able to tap into too much of what the other person's doing unless it's advertised on the local country music station or the free shopping papers. So that is one thing that we're going to try with the listserv, keep everybody updated on what everybody's doing. And for us, a partnership between Southwest Technical College and UWP to get into both of their medical and their early childhood programs and start educating them on how to be those first point of contact screeners. It was a really good way to get into a resource that not a lot of people saw from the beginning, because this is an equity action lab, but right now sometimes that equity word doesn't necessarily mean for the rural area. There are disparities, there is equity that needs addressed in our rural area, and that's really just what we're trying to accomplish with this. What's next? I'll go through these real fast, Nicole. If you want to put them all up, that's fine. To be able to thank and promote those businesses that were part of all this, we want to publicly still do that. Thank yous / news articles. We've had quite the turnover in our papers recently, and just when I think I get an article wrote, we have a new person in our newspaper. So that's an unexpected barrier. Establish scheduled check-ins for progress and next step actions. We'll be honest, with Jamie being really busy, her and I have not checked in very much, but in talking with her, it kind of reminded us both about what we had agreed to and everything. Collaborate with each other, develop talking points and tracking. Okay, so this is a big one. With all of this new screening and everything, this still is being done actively by myself with the information of who's getting screened and how they're getting screened. It's able to, I can take that data to providers and prove to them that there is a need for them to do some type of therapies out here in Southwest Wisconsin. And here's the cold hard facts. It's not just some crazy lady that's showing up in front of you. Hand this innovative sustainable action mode off to the next community to replicate. So my whole thing with all of this and anything I do is it should never end with Southwest Wisconsin. It should only start there, and then to end with a visual. I'll have it in a binder, and y'all tell me who needs this binder, and I'm gonna hand it to you, because if it works, you don't have to go through the work and effort. You take it, you make it better, you make it for your community. The last slide here is just, to me, it encapsulates all of this, because a lot of times, a lot of all of these things that I find myself into are a big dream. But when you write it down with a date, it's a goal. With the goal broken into steps, it's a plan. The plan backed by action, it's reality. So I want to thank all of you that were partners with us on this journey for helping us. I apologize if I have not kept my pace up on this, but we'll get there.
Thanks, Rose. So, in a nutshell, this was a locally owned effort to move things forward on screening and referral in rural Wisconsin, and just huge accolades to Rose and everyone in that team locally. They did the work. We came forward with tools, and then we stepped away. So I think that's a promising approach for accomplishing change in other areas. So both of these bright spots, there was a need, there was an approach adopted, change started. So if you want to learn, we don't have time for questions right now, but if you want to learn more about action labs, equity action labs, and I know that the maternal and child health program does, want to pick your brain, Rose, and see what they can do about this in the future as a strategy. You can reach out to Rose or to the Wiki team. So the folks you're getting emails about the Act Real Estate team from, and we will connect folks so that we can share that learning. So we're going to take a break. We're going to take a 10-minute break. My watch says it's 1:42. By the time I let